This is a video of a full gold crown preparation on tooth number 14. So we'll first start off with the occlusal preparation. For a full gold crown, the occlusal reduction that you're looking for is 1 to 1.5 millimeters of uniform occlusal reduction following the contour of the tooth. So you're basically trying to follow the occlusal anatomy, and there are several ways of doing occlusal reduction, and the technique that you're looking at right now is a planar reduction. Planar reduction is where you're reducing the tooth surface along the planes of the occlusal surface instead of using depth orientation grooves. The advantage of using this specific technique is that it's easier to even out the surfaces as opposed to using depth orientation grooves, where sometimes it might be difficult to even them out and create a smooth surface without over reducing the tooth structure. But there is one catch with this specific technique where it's hard to recognize how much tooth structure you've taken off, and most often than not you've taken out less tooth structure than what's necessary. So best practice in this situation is to use a putty index to evaluate yourself and to evaluate how much tooth structure you've removed. It's always better to err on greater side than the lesser side. So the reduction you're looking for is 1 to 1.5 millimeters. It's okay if your reduction goes a little beyond 1.5, keeping it less than 2. But if it is less than a millimeter, then you don't have enough space for your full gold crown material. So make sure that your occlusal reduction is between 1 to 1.5 millimeters. There are different instruments you can use to perform this reduction. In this specific video, you're seeing us use a round end tapered diamond burr, specifically the 856016. I like using this burr because it's even, it has a round end, so it's not going to create any sharp ridges. But I also like using a carbide, like a 55 or a 57 carbide. I feel that it gives me a faster reduction, but that's something that you can try using once you're comfortable with this kind of a preparation. So as you can see, you have to orient the burr parallel to the inclines and use a sweeping movement to remove the tooth structure. You have to follow the up and down contour of the ridge and the cusp inclines. Remember that the occlusal morphology is never flat. So once you've achieved your occlusal planar reduction on the buccal side, go on to perform it on the lingual side. So you can start off with your functional cusp bevel. Starting off with a functional cusp bevel and then proceeding to the reduction on the occlusal side will help you, because most often you're losing your functional cusp bevel when you're reducing your cuspal area. So once you've reduced your cuspal area, you can come back and re-establish your functional cusp bevel that you already placed in the beginning. So what kind of orientation would you place when you're doing this functional cusp bevel? A best practice is to orient your burr parallel to the palatal incline of your buccal cusp and then transfer that onto your functional cusp bevel area. So this has to be pretty evident. So as you can see, we're reducing quite a bit. Now you can move on to your palatal cusp reduction. So while you're doing your occlusal reduction, remember the clinical relevance of this step. So for a full gold crown, you're expecting to have a millimeter at least reduction on the non-functional cusp area, which is the buccal cusp on the maxilla, and a 1.5 millimeter functional cusp reduction, which you can achieve when you do your functional cusp bevel. Once you're done with your occlusal reduction, Try to articulate your maxillary and mandibular arch and look for clearance. Sometimes with typodonts, it's hard to get accurate articulation and it can be different from one person to another. So that's when your putty index comes into best use again, because that's something that is going to be standard across whatever examiner is looking at your prep instead of you trying to articulate it. So you saw how we went back and re-established our functional cusp bevel once we do our lingual reduction, and we're also establishing our palatal groove area and creating a separation between the mesiolingual and the distolingual cusp, and that kind of continues with your functional cusp bevel so that you can continue to maintain the anatomy that you started with. Once you're done with your occlusal reduction and re-establishing your functional cusp bevel, our next step is axial reduction. So the goals of your axial reduction is to remove adequate amount of tooth structure so that you remove the natural undercut of the tooth, to gain your path of insertion, and to achieve a 6-degree ideal of total occlusal convergence. So continue to use your round-ended tapered diamond burr, an 856016, and use that to start creating your axial reduction. You can start on the lingual or your buccal side, whatever is most comfortable for you, and start by placing the margin at about 1 millimeter from the marginal gingiva. And eventually, when you're finishing off your tooth preparation, you can start to migrate your margin so that it's about 0.5 millimeters from the marginal gingiva. If you try to place it closer to the gingiva at this point, there's more chances that you're going to make it equigingival or worse, subgingival. In cases of typodont preparation, ideally, examiners are looking for a supragingival placement of your margins. So the movement that we're using here is what I like to call a paintbrush movement. It's just sweeping movements. You're not trying to force your burr on the tooth. You're just trying to sweep away tooth structure as you're painting on it. Blow away all of that tooth powder that you created right now and keep evaluating how much you've reduced. Again, this is when your putty index comes into use as well. When you're making your putty index, make two different types of it. One that's cut buccolingually and one mesiodistally, so that you can evaluate the amount of tooth reduction in different planes. And now you can move on to your buccal surface. This reduction can also be done using depth orientation grooves. I personally like planar reduction, but again, that's when you have a putty index and you're confident how much to structure you've removed. You don't really have to lean your burr in any specific direction to remove the natural undercut of the tooth. The burr itself has a taper, so once you place the burr parallel to the long axis of the tooth, it's going to give you the taper that you're looking for. So remember that the buccal surface also has two different planes. So when you're doing your axial reduction on the buccal surface, remember that once you've done your cervical side of it, you have to lean your burr a little bit occlusally and create that taper that you're looking for. Our next step after axial reduction is interproximal reduction. At this point, you can switch to a smaller diameter burr, like an 856-012, a needle burr, to help you navigate that small space and to give you the confidence that you're not going to hit the adjacent tooth. And if you're still afraid that you might touch the adjacent tooth, you can use protection like a matrix band, or you can use a fender wedge, which comes with a wedge and a matrix band that's a little more tough. So that gives you a little bit of wiggle room. So if you hit the matrix band, you're still not going to damage the adjacent tooth. So slowly navigate the space and break the contact. That's our goal over here. With proximal reduction, you're trying to break contact and create convergence to aid in your path of insertion. The motion you're looking for when you're breaking this contact is called a sawing motion, where you're working your burr through the proximal area in an occlusal gingival and a buccolingual direction. Once you're done with your distal surface, you can move on to your mesial surface and repeat the same movement, a sawing motion. And once you've achieved sufficient room to maneuver a larger diameter burr, like an 856-016, you can switch to that larger diameter burr and start creating that margin you're looking for. So the margin we're looking for in a full gold crown is about 0.5 to 1 millimeters in width. Ideally, it should be 0.5 millimeters, but try to keep it within a millimeter, because full gold crowns usually do not require too much of a diameter. At this point, our preparation is looking pretty good. We just need to switch to a larger diameter burr. this point, you can start refining your preparation, and it might be a good time to switch to a slow speed handpiece and a red stripe diamond and start refining your preparation. So, when you're refining your preparation, you're basically just smoothing out your margins, removing any J shaped margins, taking away any scratches. And you can also see how we are creating that two plane reduction on the buccal surface as well. And move your burr around the tooth to make sure that you have a smooth flowing margin, no steps, nothing sharp, and an even taper all around. When you're refining your occlusal aspect of your tooth, also take away any sharp line angles and point angles. Our functional cusp bevel is only on the palatal side, but you also need to create a very small bevel on the buccal side to remove sharp edges on the cusps and any scratches that you've created on the tooth surface when you're working on it. And to finish your functional cusp bevel area, you can also switch to a football burr, and this is also a red striped burr, so it's not something that's going to be really coarse that it starts to make your tooth preparation look really rough. You can use that to maneuver and create a smooth finish on your functional cusp bevel area. You can also further finish this tooth preparation by switching to another diamond burr. This diamond is a little different. It has a flat end. It is an 847 burr, 847016. You can use this burr to finish, especially on the occlusal surface, to create some sharp grooves. However, keep it away from your margins, because for a full gold crown, we're looking for a chamfer margin, and this specific burr would end up creating a shoulder margin. But you can use the surface of it to smoothen out things, especially on the occlusal surface. As you can see right now, we'll be using it to smoothen out the occlusal surface and create some sharp central grooves and buccal groove area, especially because the terminal end of this burr is flat instead of round. So that's basically what we're looking for in a full gold crown preparation. Everything's rounded, you have a good functional cusp bevel, 0.5 to 1 millimeter margin, an axial reduction of an even 0.5 to 1 millimeters, and an occlusal reduction of 1 to 1.5 millimeters. And I think that looks pretty good.